Hello, everyone. Thank you for coming to today's event. So I'm Dr. Ishan. Oh, hold on. Why my name is changed? Umi, did you change my screen name? Okay. So today we want to talk about, the recent two tragedies in our Asian communities, the two mass shooting events. And so first I want to introduce our host organizations, and then we can invite a panel of therapists joining us. They are like Asian therapists serving the community in California. So I'm Dr. Yishan Xu. I'm the founder of Mind Body Garden Psychology Clinic. And I know many of the therapists going to join us today. And Eva, please feel free to introduce yourself.
Hello, everyone. I am Eva Wu, a member of the Society of Heart's Delight. I'm grateful that the organizer at Mind and Body Garden Psychology, Dr. Shi, is putting together this event and inviting us to be co-hosting. So together we gather Asian American community members in the area and beyond to discuss the important topic of the mental health issue with the elderly Asian males in our community. So I just want to give a quick introduction of our community. Society of Heart's Delight, we're a bilingual community of Chinese immigrants who moved to America as adults. We're primary professionals who live in the Bay Area. And our overarching mission is to build bridges between diverse people, perspectives in the Bay Area in order to promote understanding and community bridging and enrichment in this placemaking we're doing. So without further ado, I'll hand it over to Dr. Xu.
Thank you, Eva. Very happy we can collaborate with different organizations in the community to really talk about this important topic about Asian mental health. So we have several therapists who serve the community here joining us in the panel. We have 2 so far, and there are several more who will join us later. And Xiyue and Li Fan, please feel free to introduce yourself.
Okay, I'll go first. My name is Xiyue Wang. I'm a licensed marriage and family therapist. I'm currently working in a community-based mental health agency. So many of the clients I see are Asian Americans, especially elderly population. So I'm very honored to be on the panel today and looking forward to a good discussion with all of you.
Hi, good evening, everyone. My name is Fan. I am a licensed clinical social worker, also has been working in the Bay Area, serving the Asian community for over a decade. Similar with Xiyue, so I currently also work in this medical setting as a clinical social worker manager, primarily serving the Chinese and Asian population. So it's really a tragedy after heard about the several incidents happened in our community, especially the nearest one happened in the Bay Area. Really shocked. So I think this is a great opportunity having several mental health professionals gather together to brainstorm to processing this tragedy event and then brainstorming some solutions to support our community. So it's my great honor. Thank you, Dr. Xu, inviting me.
Thank you for joining us. It's also our honor to be able to have so many great therapists talking about this issue. So first, I want to discuss a little bit what the mental health issue look like in the Asian community right now, like how severe the mental health problem is, and based on your clinical observation, and is there anything you want to share regarding that?
Do you want to go first?
Dr. Xu, actually, I was just trying to. Actually, I was trying to make a point just now, and I kind of forget. It's mental health, but because we're when we look at the this issue, it's actually it's very intricately related to a lot of circumstances they're in. It's mental health, but it's beyond mental health. So as a community social organization, we also think elderly Asian Americans, just like other marginal immigrant groups, they desperately need community support and to overcome this kind of social injustice and loneliness and mental health and maybe economic, a lot of issues they're encountering in their lives. And for us, we think we'll have a great discussion about mental health. But beyond that, we just want to make a point that if we as a community don't take care of those most vulnerable groups of society, that there's no volunteer taking care of them, social workers, the consequences can be devastating, that as it was shown in the back-to-back shooting. So I just want to add that, but I'm happy to chime in later. But now it's time for the therapists and psychologists to give their view. Thanks.
Mommy.
Thank you, Eva. Yeah. So I just want to share a little bit data before, and Xu and Li Fan feel free to chime in to contribute any ideas, observations you have. I think it's great that we all are therapists from different backgrounds, like Li Fan, a social worker, and Xu is a marriage family therapist. So I look into some data from recent decade. So based on the National Latino and Asian American study, Asian Americans overall has about more than 17% lifetime rate of any psychiatric disorder. But Asian Americans are 3 times less likely to seek mental health services. So I think that's very concerning data. And I don't know, based on your clinical observation, what are the barriers? Is this match what you all observe?
Yeah, I do think, so but when you ask how severe the mental health issues are among Asian Americans, it's confusing, right? Because the lesser rate of looking for help doesn't mean that this community is healthy or just mentally healthy, right? So barriers are in between that, having mental health issue and actually looking for help, or even like Eva said, even looking for community support, not necessarily like mental health professional support, right? Many of my clients, like older adults who recently immigrated to the US, I feel like they're just interacting with their own families and not even interested in maybe kind of like making connection with neighbors, or like, that's if that's not even possible, let alone going for a therapy session or look into their mental health issues, right? That's too much of a step to take. I think that data is interesting. It's just there are less people looking for help doesn't mean there's less problem.
Yeah, I agree with Xu. I think she made a great point, because Asian, typically in under American culture lenses, we are deemed as what's it called, the advanced minority, or
Model minority.
Yeah, model minority. Yeah. So exactly. So the data showing less Asian Americans seeking for mental health doesn't mean that it happens less among Asian American population. But actually, I think because of so many aspects of issues, like culturally issues, or resource issues, or lack of awareness, so hinder people to reach out for services or even admit there is a need for mental health. So especially happens among elderly Asian American population. We see in clinical setting, I see a lot of Asian elderly population that it's very hard for them to admit they have mental illness issues. Admitting that they're not feeling good or not feeling well connected, or even have some thought to harming themselves or harm other people is a shame, because there is lack of a language in Chinese language to describe those feelings, and also like lots of negative stigmas attached with emotional descriptions. So especially like typical Asian culture, or the Chinese culture more particularly, male has a strong authority figures. So admitting they're not feeling well, the male not feeling well, is a shame, and rarely can seek acknowledgement or support from the society around. Even female may feel like, oh, you can get over it, don't worry about, or drink few cup of wine, you can feel better next day. So culturally, and then lack of resource or lack of awareness, so many different layers of the problem. Doesn't mean that Asian American doesn't suffer mental illness as many as other minority or as ethnicity groups.
Yeah, totally agree. A lot of stigma and model minorities are all the common source of stress. And we have a new therapist join us, Kian from San Diego Asian community. Also
Hi, everyone.
Hi, welcome.
Sorry for being late.
Oh, no worries. It's a chill discussion. It's an ongoing discussion. I think it's not, I hope the discussion does not just stop here for everyone in the community. I hope this is just the start for us to really start thinking about all these resources and the mental challenges we are facing. So there's another research I want to share from 2007, actually, touch on some of the things you guys mentioned. The University of Maryland School of Public Health research team. So they are studying Asian American, younger Asian Americans between 18 years old to 30 years old, especially the second generations. What are the common source of stress? What you all talk about just now is definitely there. This pressure to live up to this model minority. And there's a lot of stigma towards mental health issues, and also the parental pressure to be succeed in academic. It's also hard to find social support to talk about any mental health related concerns, and in the family sometimes it's hard for the family member to understand that too. Also in Asian culture, there's a strong family obligation to take care of others, take care of family members, and there's a strong culture and traditional values. Another challenge, I think, for Asian Americans, according to this research, is how to balance these two different cultures and really develop a bicultural sense of self. Yeah, so I think that's it's a lot of things what we just talk about, and especially the stigma in my clinical work. I definitely see that a lot. A lot of time, older Asian population come in for therapy. Actually, they were encouraged by their children, their younger children, think, oh, my parents really need this. But these parents themselves, they're like, we don't really need this. What is this? Why I need to talk about my feelings, my thoughts to a stranger? That's a new concept, I think, to a lot of older Asian immigrants. I don't know what your observations are.
Yeah, along that line, I think definitely this is a back to our upbringing history and the environment. We're not encouraged to talk about our feelings, emotions. Just talk about the fact, more focus on the concrete facts. Oh, I did this and did that, achieved this and that. I went to college, a check mark on my life list. But rarely were we encouraged to, how do you feel today? How are you feeling today? Just more, there's not a language environment to describe our feelings. Sometimes even like in the I'm trying to translate some English psychology articles to Chinese and feel like, oh, how should I describe this in Chinese? So I think deep rooted in our culture, we're lack of the language capacity to describe our feelings. Not even talk about the some immigrants who came from very low socioeconomic status or even low education background. They were not well educated, and then also after they came to the United States. So acculturation can be a very challenging experience for them. And also another layer of this issue I recently noticed that because of the pandemic, it just stressed out every single one around this world. And then for lots of elderly population, their only channel for socialization is through cell phone. So, and then their language capacity limitation limited to their information outlet. So they only read or respond the information or process information in simplified Chinese on the social media. And then on the social media, there's a lot of tragic news. And then it add on another layer of a stressful mind process. So in clinical setting, I see lots of elder patients tell me, did you see this news from the WeChat? So bad, so sad. I don't know. I'm like, yes, that's true, but that's not the whole not the whole picture of the life. Can you just put down your cell phone, look around, and then try to engage in real people, talk to your therapist about your feeling? It become more and more challenging. So this social isolations, language capacity, lack of language, emotional descriptions. Okay, I'm like, this is, now I'm thinking about this. Okay, I'll come back later.
So I'm just curious. I'm hearing so kind of a lot of aspects you were mentioning. So there was this stigma associated with the Chinese culture where we come from. There is language barrier in the new place, being able to integrate into the society and communicate with others other than their family members. There's cultural clashes. And there is there's a crisis of self-identity. Who am I, right? So, and then on top of that, of course, pandemic, a lot of lives are taken, a lot of tragedies happen, being stuck in their media bubble, especially, in China, a lot of tragedies happen. So I'm just curious, like, as you guys are giving your clients advices, right? As social groups, or I mean, the nonprofit world, the philanthropists, doing philanthropist work. So what interventions before they come to you? Of course, there are two layers of a question. What advice you're giving your clients, but before they even come to you, what kind of interventions or what kind of things can prevent that the mental health crisis got so bad that they have to take it on their own life or other people's life? Is it like, can we encourage some nature therapy, going out hiking, organize group? I'm just thinking. Or can we organize mindfulness meditation centers to do outreach to these people? Because I go to Insight Meditation Center in Redwood City. In this area, we have a lot of resources, and Zen meditation centers, a lot of them. So can are there solutions out there, easy solutions out there that you would recommend to your clients?
I wouldn't say solutions, but I think definitely many channels of a community support definitely would help prevent the mental health issue from just going forward and going to a place that's the client has to take medication or seek support. So engage in more family life, right? To enhance kind of that family interaction, connection, have some quality times to talk and process what's happening. That often would fall on kind of the younger generation, because they would be the one to kind of initiate and really ask how parents are doing, especially for older population. And like community support, I do think I agree with you that the Bay Area, we have increasing supports around in the community. I don't mean to advertise, but our agency, AKI, Asian Americans for Community Involvement, we have senior wellness center. Like they host Tai Chi class, Kung Fu class, and yoga. There's like in-person activities. They also have like English class. So a lot of activities to for elder people to participate. But it is really, we need to get the word out and invite people to come. That's going back to the awareness, right?
Yeah, I agree. I think I really like this approach, this question you are asking, because a lot of time as therapists, as in the medical field, in the whole healthcare field, a lot of time we do treatment after the things happened, right? And a lot of Asians, when they come to us, they may already have severe symptoms. They may drag along. They don't want to come until they have to. And not a lot of people understand this. So nowadays, I think over the past 5 to 10 years, I see a lot of tendency in this field to really focus on prevention. Like in the past several years, the thrive of positive psychology, right? Mindfulness. A lot of those, they are not only interventions afterwards, they are preventions before things happen. And now even like mindfulness technique even are taught in school in younger kids, right? And they really benefit from that. So I think that's whole society, this whole system, what we can do. Li Fan possibly can talk more later because she worked as a clinical social worker for many, many years, knows a lot of like this resources, has a lot of experience. But from my point of view, like us, Mind Body Garden as a outpatient clinic, we do a lot of treatment. But myself, all those years, I try to do a lot of public education. I think knowing, this, you keep on hearing this kind of words, this kind of knowledge enough, then maybe at some point you will not feel like the mental health or therapist, this kind of resource is a scary thing anymore, right? The more you understand our emotions, the less scary it becomes. So I feel like public education is definitely part of that. And hopefully in the process of this, we will be able to learn what are some strategies we can start practicing when we are a little bit down, not to wait and surprise and eventually explode in a horrible way.
Yeah, I think initially when Eva asked this question, I couldn't think of a good answer. Because for a whole society, I think, yeah, we're lucky to live in the Bay Area, and then there are already lots of resources, but still not enough. Like when we desperately look for one particular resource, it isn't always couldn't find a good match. But I think, yeah, Ishan mentioned a really good point that just the more public health, the more we can talk about the mental health in the public setting, can raise up the awareness, the more we can help to reduce the stigma, make a open conversation. Because I do see more younger generation, like they have a stable job and they have good insurance, they're more willing to seek for mental health support. But again, for less socioeconomic advantage group or for elderly people, mental health still not an acceptable concept in their life. So
I'm just curious, how much of it is an economic resource issue and how much of it is a stigma issue? Because you talk about the insurance coverage, of course, a lot of these elderly are probably only covered by Medicare. But I'm not sure whether Medicare covers therapy sessions. So I'm just curious. What do you think?
Yeah, definitely Medicare cover mental health services. Like I currently work for a Federal Qualified Health Center, FQHC, and lots of patients has Medicare, and the Medicare cover the mental health sessions. but I think the issue is still there is between self-awareness to seeking the services. There's a big gap. Because, for example, where I'm currently working as a primary care setting is routinely at an annual physical exam, we give out patient a PHQ-9 questionnaire. PHQ-9 is a questionnaire public used to measure the depression score. And even though some patient has a very high score, and then our staff reach out to them, they still feel like, no, I'm too busy, I'm fine, and decline the services. That's why when I see the news happen at Half Moon Bay, I feel like, wow, this is just the hardest population in our clinical work to reach, because he's elderly and he's low socioeconomic status. He may gone to medical setting and then may express a little bit of his emotions, but didn't get catch from the early on prevention stage, or maybe he turned down the offer, the help. So I think, Eva, you brought a really good question. How can we, as a mental health professional, how can we be more flexible to reach out to the population who mostly need the services, instead of for them coming to seek out services?
Yeah, I was just thinking, between, on the preventive side, seeking help side. So what can social organization, nonprofit groups, or community organizations, what kind of volunteer work, what kind of resources they can organize to do to support this group? Because, there is definitely language issue. It's not as easy for them to just call up. They don't even know where to go. Should we set up a WeChat account, or to just? I'm just thinking out loud. What are the gaps there that maybe founders, philanthropists, social organizations, government grants should be extending resources to?
I think Shia brought up like an interesting point. Like you saying Bay Area, there are like Tai Chi club and things like that.
There are a lot of resources. Yeah, but
Yeah,
a lot
there
of them are in
so
English.
they can like
In the Chinese community, but there are ones in Chinese community. There's elderly center in the cities, in the the city council. I mean, I guess city sponsored some sort of programs.
Yeah, I was just thinking that's a great like idea, because I don't see a lot of that in San Diego, like towards Asian community, especially. So I was like, if like elder people, they can socialize in that setting, I feel there will be less like isolation, or at least when their mental health like start having some issues, like people can recognize that. I realize a lot of elder people, they have mental health issue because they don't talk to their children. They have bad relationships. They don't have any friends. So that's why they kind of suffer a lot. Yeah. So I think some community resource around, maybe like even hobbies, because I know if you say it's like a mental health thing, they probably don't want to go. But if it's like a
we all have
hobby,
parents who might be visiting us or living with us, and I can relate to that, because my parents are very active in China. When they come here, they feel lonely. But I live in Mountain View, where there are a lot of Chinese American friends, and their parents and resources, and they go to city council. I think the city has they give they have bus the elderly to a center, like kind of provide them free lunch. They don't really need free lunch, but they just want the opportunity to see other Chinese elderly and talk, even if they're just here for a few months. So I can totally relate. If a city doesn't have that kind of public service, or a community doesn't provide that kind of service, everyone's isolated. That's really hard.
So
Yeah,
I believe
definitely
if
agree.
more nonprofit agencies are able to do similar or organize similar events as Aki, right? And have the staff kind of trained to recognize signs of severe mental health issues, and know when to maybe ask the senior to seek help, right? And that can be a point to break that, to build that bridge.
Yeah, I agree. And also there, like what you guys mentioned, if there are more translation available or more, this language barrier can be break down somehow, that definitely gonna help. I want to quote another research because I think I saw research really relevant and very new. It got published in 2020. From New York again, New York is also a large city, very active, right? Possibly much easier to walk around than here. They are studying the older Chinese immigrants who live in New York and try to find out what are the stressors and the barriers for their mental health. So what they find among these elders, those who are a little bit younger, have less than a high school education, and had higher level of depressive symptoms are more likely to use mental health services, actually. And they do identify the two stressors of the psychological distress, including what we all covered. First is the support system, and second, language barrier, and the third one is the financial hardships. So those three are really the stressors. So what really impacts these older Chinese immigrants to seek mental health service? They identify the 5 top factors. One is information from their family or friends. Second is the referrals from the primary care physicians. So the third one is a perceived need for help. First one is mental health stigma. And the fifth one is culturally competent mental health professionals. Yeah.
So supply side is also a problem. We need more people like you guys.
Yeah, and hopefully, but maybe not only therapists, right? Now we are thinking what other people can really offer different level of care, because in mental health field we have different level of care. Like our clinic is an outpatient clinic, and I think Li Fan and Xue all work in different organizations. Some of them have both outpatient, inpatient, and different options, can handle different level of issues. And now I know there's a lot of coaches out there. There may be other different type of services. Yeah, so I don't know what are some resources available in the community that people can be more aware of.
Yeah, one more thing, just along this topic. One more thing about this I want to address is also there's a strong stigma around psychiatric medications. When I suggest some of my patients to try it out, like very mild or SSRI or some antidepressant and anxiety medication, very typical question from Chinese patient are, what are side effects if I would be addicted to it? So those are the very common stigmas around medications. So I have to spend lots of time provide psychoeducation around psychiatric medication, especially popular use, common use antidepressant and anxiety medications. And then rather they would seek out like other alternative helps. Maybe helpful, maybe not, but they would say, oh no, I tried this way, I tried that tea, or I tried that kind of eating method that helps me. I said, okay, that would be great. But at a certain point, when the symptom becomes so severe, I still think would recommend the psychiatric medication, and then they still have a lot of resistance to try it. So again, down to the public education part. If we can publicly educate or spread out more evidence-based information to the public, will be much more helpful.
Mm-hmm. Yeah. Before continuing, I want to introduce Dr. Song just to join us. Dr. Song, welcome.
Thank you. Sorry about being running late, caught into the traffic. Traffic has been getting worse and worse. So I don't know kind of what you've already talked about. It sounds like I want to just add on to what you're just talk about a few issues that you address, and also I think maybe Asian elder, males in this in the United States. Maybe another layer is like maybe racism, and Asian tend to be kind of invisible. And as elder, especially it's like immigrant from China, and they don't have so much community or connection resources here, become even more isolated. That's maybe another layer of cultural or systematic the oppression on that. But it may be kind of, a lot of them may not recognize that. They feel, okay, in this kind of country, I don't feel like being seen or can be heard. And plus being elder. So I think that's also will exacerbate mental health or alienation. And so, yeah, I also wonder what we can do to address those layers of issue and also provide the support that's like culturally congruent, like, because there's a lot of kind of resources here. It's like tailored to American culture, and how we can provide something actually is more tailored to Chinese culture for this kind of community.
That's a very good point, Dr. Song, because I went to grad school in New York, and then very interesting because when I was trained, and then the education was very focused on talking therapy. And then and then when I asked my professor why we're focusing on talking therapy, why people really, I was really amazed on how open patients want to talk about their feelings. And then my professor pointed out, this is our school, or at my program was primarily attended and taught by Jewish population. So talking is very popular and comfortable among Jewish population. Instead, in Chinese population, I don't feel like talking about feelings or talking to a stranger to process our thought is a common accepted factor. So I think Dr. Sun pointed out this is really important, just how we can make up more creative, culturally appropriate, and language appropriate services to Chinese population instead of just promoting the traditional Western mental health services.
Right. Yeah, I do kind of like the training that we got is like mostly based on white, kind of European white, that kind of culture, and like something like a assertiveness training or something that maybe not quite tailored to Chinese culture. Maybe kind of there's some other. We feel kind of like the family, the affiliate, kind of like, what is that? 孝系孝那个叫什么? The close tie between kind of parent and child, that kind of connection, maybe not well understood by a Western culture. So I think maybe also really need to be mindful when we kind of like trying to address those kind of mental health issue. Kind of makes I think that you bring good point, Fan. That maybe like therapy doesn't necessarily have to be like talk therapy. Maybe do something like a qigong or kind of like Tai Chi when they kind of have a group of people, elder people, like in China, they practice all those things. That feels like very therapeutic probably for them, and have a sense of community, but also feels like so familiar to them.
Yeah, talk about Tai Chi. I remember Kian just mentioned that there are not a lot of resources in San Diego. When I was in San Diego, I work in a hospital. So I remember in the local community, there are Tai Chi class for older community members. When I went to take that class, I found out it's open to the whole community. But when I went, I found it's mostly older Asian members who are doing the Tai Chi, but unfortunately it was not taught in Chinese. So I can see the barrier, right? For some older Chinese Asians, they really want to try this, but they may not, they are not comfortable. They may not even be able to speak really good English. So it's hard. Even these kind of resources are there. It's totally free. It's awesome. But if there are certain things getting in the way, or it was taught in a way hard for them to accept. Definitely. Right. Yeah.
Yeah, I think I remember I came across a video. I think it's a Qigong meditation. It's like incorporate Qigong into mindfulness meditation. I think that kind of resource can be really like acceptable to those elder like population, because they may not think it's it's about mental health. They may not have stigma about it. So
it's interesting you brought up the qigong, tai chi, and qi contemplative practices. I find out that there's actually a revival of that among some highly educated PhD, MD type Westerners in the West Coast and in Europe. I personally know a bunch of them following Qigong, Tai Chi type of Qi meditations practice. But they're taught in English. There are a lot of them taught in English, but there was taught in Chinese as well. And I think what we really need is to reintroduce those are from our cultural roots to the elderly in America, and organized groups have Chinese language service, teachers, coaches, and that can really help, because the sense of community and be plugged back into one's cultural roots, and also it's clinically evidence-backed benefits to mental health. Yeah.
Right. Yeah, exactly. I feel actually like our mental health field, I'm really into trauma treatment. And since like we really have in the past decade kind of evolved into actually not just talk, like let the client talk about their story that can help with trauma recovery. Actually, it's like now more into like a neuroscience part, which also kind of focus on like how to move our body. And actually Professor Vandekal, who is such expert in trauma field, he actually really advocates therapy really doesn't, talk therapy is not really applied to everyone. Actually, some people can get treatment just through dancing or kind of qigong or tai chi. They actually really
breath work, easy breath work. Yeah. I actually work with a philanthropist who found breathwork study at Stanford. So a lot of simple practices can have huge benefit in mental and bodily health.
Yeah, because that actually change your neural kind of like connection, actually help to process trauma or mental health or in general. So we actually have a lot of like wisdom in our Chinese culture that we have not been really digging out, I think apply into mental health field. So actually we can really kind of advocate for those kind of incorporation into our intervention.
Yeah, and we talked about stigma earlier. And I'm not sure whether we are giving a lot more details. What are some common stigmas, mental health related stigmas among Asians, especially older Asian populations you all have witnessed?
I can talk a little bit about that. Just I think we gather here together because of the recent tragedy. Because I'm still following some of the news and trying to. There are more and more investigation released to the public, and then more details come out. So, especially for the Half Moon Bay incident, the shooter he experienced lots of bully. He mentioned that he was bullied by the owner of the farm. Wasn't understand about this. He couldn't understand about the situation very well. He couldn't advocate for himself. He had lots of like barriers to seek out for help, and then lack of resources, and very isolated environment, and long hours working, and non-insured, I assume. So by thinking of like just replaying this, and then after the incident he was caught, and then he admitted he did the shooting, and then he felt he was in a not well he wasn't in a well mental state, so he wasn't sure what he was doing, or maybe he was very stressed in a not clear mental state status. So I was wondering, like, what if there's so many steps we can prevent this tragedy happen? Like, for example, if someone can reach out to him, or if someone noticed that he works so long hours, he's so stressed out, he needs to take a break to protect his right, that can help with this situation. Or if someone noticed that he can get some talk to someone, seek out for some more understanding or financial support, or maybe labor law can protect him, that also can help out with that with that particular situation. He needs to pay back some $100 to the owner of the farm. And also maybe he's just his peers who notice he's now in the well mental state, maybe point out that you need to talk to someone, or maybe you're not well. I don't know. I'm trying to just thinking through this tragic incident, replay this, how we can help him, how we can prevent this happening. I think one stigma is, back to Dr. Xu's question. One stigma is that when talking about mental illness, people always say, "Oh, I'm crazy," or people would think I'm crazy. I'm not crazy. I'm just stressed out. Maybe it's just I'm too tired, or maybe I just need to vent to someone, talk about my emotion, my recent experiences. I'm not crazy, mildly crazy. So that's a misunderstanding or cultural misunderstanding part there in terms of the stigma.
I can totally relate to that, and that denial is a very inherited kind of reaction. The first reaction a lot of Chinese elder population would kind of have. That's the first thing that pop up in their mind. No, that's not right, right? And even I think what you mentioned, Li Fan, even if people suggest that they are not in a right mental status, they would find other like reasons or other evidence in their physical health to explain to themselves, right? To make sense of it. It must be my headache. It must be I have heart issues or things like that. That's what I see, because our agency also, we work closely with primary care providers. Our doctors have a lot of Asian older adults who would not admit that they have depression and just like insist, no, this is physical issues. You need to treat me. You need to give me the right medication. Where our doctors are like, no, there's nothing I can help, and they wouldn't take that referral to see a mental health specialist. So that's one.
And of course, mind and body affect each other.
Yeah,
so
yeah.
It can actually manifest in the physical symptoms, but the root cause can be mind. Yeah, that's great. I was also curious, Dr. Xu, you mentioned you do a lot of public education programs. So for this, I can see that there's the self-care part and there's the caregiver part, because a lot of them, if they're elderly, supposedly there are people taking care of them, or there should be, right? So what kind of education program would be effective in terms of raising awareness and seeking help and understanding what's going on? Yeah.
Good question. I'm not sure there is a very good, already well-established educational program there. I think different organizations have their own program going. Overall, I hope, because there are books, there are nowadays podcasts, YouTube, there are a lot of things. I hope just family members and even friends, everyone in the community, if we can all learn some basic like warning signs, right? Some warning signs of depression, anxiety, so we can help identify there's something not quite right. And we also, if we can all learn how to talk to someone stressed out, not make the stigma even worse. When they share their feelings, we don't criticize them or try to fix them or throw a solution to them, and or tell them, well, it's nothing, don't worry, you think too much, it will all pass and be good again. So sometimes people don't need those kind of things. So I feel like some very basic, what is empathy, what is listening, and how to help these family members, older family members, feel like they are understood. And then it's easier to link them to resources, right? So I feel like it does not need a specific program, but it needs a lot of more education through books, videos, different things. If us all, I think that's not only for all elders or their family members, it's for every single one of us, from children to parents to young adults, right? Elders, if we all can learn some basic psychological this knowledge, then we can care for each other. So this, I feel like this burden should not be on certain people or certain family member. It's just overall in the public, we should all know some basics. I know there are some programs targeting certain groups, like police officers. Nowadays, they have programs to really learn how to identify certain warning signs and how to talk to people who are mentally stressed in the moment. And emergency room doctors, sometimes they need to learn that too, or they have mental health providers on the team, right, to help talk to the patient very briefly or evaluate. So primary care in the hospitals, when I worked in Kaiser Hospital before, I know the primary care unit have a psychologist on board already to help with this kind of issues. Also identify, are they at risk, and how can you talk to them very quickly to help them manage so they can they are okay to leave, right? Yeah, so I think now more and more you can see from this organizational level, people are doing more. And then I hope to this individual level in our daily life, we can learn more. Yeah, that's my hope. But I don't know whether any of you know any good public educational program people can learn. Oh, I know one very popular, the first aid in mental health, psychological first aid program. I think that was supported by the government. It's free for a lot of community members, for family members. I don't know about any other resources.
Yeah, I think that's a really good point. Instead of like wait until they get to this point, like what happened in Half Moon Bay, but do more like prevention, public education. Like it's not just that person, one person's kind of like a burden, but it's like system. And if everybody, we kind of learn some basic, like learning what are the warning signs, how we can provide support, and that actually can really de-escalate from the very beginning to prevent tragic from happening. I know like some organization like in the Bay Area, like I think one, for example, like AAPI in San Jose. I don't, because I know I have a friend that who worked there, and seems like they have like all different kind of like services, like most kind of for Asian, not just the Chinese, but the whole Asian kind of elder people. So I think that those kind of organizations that actually kind of just prevention, that kind of program can really kind of do much more help prevent further harm.
Yeah. Also, there are actually a lot of public education resource in English that we could use a lot of Chinese translation service to make them available. There are a lot of nonprofit groups providing toolkits, like resources, like courses. Berkeley has a good science center, like for teenagers, because I have 2 kids. Like there are a lot of resources that are free out there. I wonder if in our Asian American community, Chinese American, we could do more, make them more available, because considering the language barrier, it's not just a pure translation, right? It's not just you also need to adapt to how people receive these message. Like there's a lot of work can be done there, but there are free resources.
Right, there are a lot of good resources, but also I'm thinking about how these resources, even they're in Chinese, how can they reach to older Chinese population, or if it's in other Asian languages, how it can reach older Asian population, because they may not really actively seeking those information. They may still read newspapers, magazines, and a lot of this good information possibly nowadays are online. But how many elders, Asians, they are really using internet, computers to really get information?
Can you make them available at the dentist or primary care? Like just print out a lot of pamphlet and
that's definitely one way.
Or arrange 99, like Chinese grocery stores,
Yeah, again, I hope the system, right, the whole society, the government could consider doing something more to promote that for the elders. Yeah, and that
just remind me, what Eva said just remind me, their healthcare industry is implementing ACEs in almost every hospital, right, and screening for adverse childhood experience. So I wonder if that can catch some of the people who are in need.
Yeah, feels like a lot more we could do, but who gonna really help do that? Because ACEs now in different organizations, I think there's a lot of hospitals, organizations, and involved to really push that. And there are a lot of evidence showing that, and how that can help us identify certain warning signs for this issue we are talking about. I don't know. Maybe we need something extra than how to deliver that. Yeah.
Yeah, I think Yishan, you made a really good point, because thinking about social media, we're all influenced by social media nowadays. And then each generation has their own preferred social media. And so for elderly population, especially for Chinese population, they still read newspaper like Xingdao Ribao or like Dajiyuan or something, the Chinese newspaper is still very popular because that's their most familiar and comfortable source to seeking information and then to get to know about the outside world. So for our generation, we tend to use social media to study and learn new information, but maybe that's not their learning source. So yeah, maybe we should put more effort on advertising or do public education on traditional media to catch the elderly population.
Yeah, I know a lot of hospitals will have this pamphlet, right? Print out, put it there. So if elders going to the doctor's office, if they see a mental health pamphlet there, hopefully they will grab. But the thing is, in a lot of primary care doctor's office, we don't really see mental health related flyers. Not very often. It's all medical related. So I think another easy way is for us to really reach out to other health care place and to provide or encourage them to provide their organization's mental health resources. That's going to be helpful.
Yeah. Sometimes I feel like in my work setting, I try to promote mental health services as the ambassador of the mental health services. So not only provide services to patient directly, also have to provide lots of psychoeducation to the medical providers. I do tell them, like educate them, like what we can do, how we can provide mental health services, why this patient has these symptoms. And then after receiving the mental health services, how patient improve the living situation or life function. So sometimes I feel like I have to promote some successful stories among medical providers, tell them see your patient came in like this, and then after my treatment, how much improvement we made. And then the medical provider can feel more confident to refer patient to mental health services, feel like, oh, they really can receive competent services and help. But another issue is what I see for a medical provider, they have their own struggles, is that all their medical appointments are very limited time. So within the time frame, they need to address the medical issues. They may not have enough time to open a conversation about mental health. And then as soon as sometimes the medical provider asks a tricky question, how do you feel? The patient may start talking, and then it's hard to reframe it in the limited time for a medical appointment. So medical provider may just try to avoid the hassle, not asking the questions. Yeah, so there's a lot of work we can do, but yeah, I see there is our opportunities.
Then near the end, I think we already been talking about this for about an hour. Hopefully, it's very nice discussion, and hopefully, whoever watching or gonna watch the recording, get inspired or at least start thinking about this more. Near the end, I'm wondering what are some other resources or any, we can throw out to everyone who is watching, everyone who cares about this, who are interested directly, not only Asian elders, what they can look for, but generally, right, their family members or anyone in the community. What are some places to find like legit resources? Nowadays, I feel like social media's problem is everyone can be a popular social media person to talk about things. Some of them does not even make sense. Some people, they may have their own mental health healing journey. They're sharing their stories. That's fine. That's good. But some people do it too much in a way that make themselves sound like expert, but they are sending out inaccurate information. So when I'm wondering, when people are really looking for this kind of mental health resources or knowledge, what are some places they can consider, or how can they tell whether this information is legit or not?
I think in general for Bay Area, each county, the San Francisco County, San Mateo, or Santa Clara County, they have a mental health specialty access line. So for each county, there's an access line. Anyone can call access line to seek out mental health services. Access line, they provide trained staff to ask to do triaging, and then ask questions, and then refer for services. If non-insured, they also can provide sliding scale services. And in terms of how to promote our services, I think Yishan, you did a great job. Just do lots of public educations, to record the videos or join the podcast, join any social media activity as possible, just to promote the evidence information, and then to break down the stigmas just by talking to more people. This is maybe the easiest way to do it.
To add on to that, maybe outside of mental health services, each county also have like website listed community resources, like legal support or housing support. Even our senior wellness center is also on there, even like the community activity support. Yeah, so but it requires internet access and kind of a little bit knowledge of technology to access.
Yeah, I think that's a good point. Not only mental health. We are talking about mental health, but it's not just mental health. It's every single part of their life. And think about the shooters. I've been reading some of the stories too. Very sad. but also can tell all this limited resources, limited social support, limited knowledge overall, and eventually, right, being manipulated or taken advantage to and suppressed to a point that it come out in such a way, took away so many lives. Very sad. But it's not just a mental health issue. It's a long-lasting financial, housing, and living, all those issues altogether. So very happy to hear counties have these kind of resources. And so everyone, if you hear this, just to, first check out the county's websites and see what kind of resources they provide. I know there are a lot of nonprofit organizations, right? NAMI do a lot of great work, and there's a Chinese chapter within NAMI. And I think it's in many, many different cities. They have good resources on their website. Some of those are in Chinese also, but again, it's need internet access. So I don't know for elders. For some elders do not have such financial ability or access what they can do. I don't really see a lot of mental health topics on the traditional newspapers nowadays, unfortunately. Yeah. So anything else you all want to add near the end? Okay, then we can call it off. Thank you, everyone. Thank you all for your time. I know all the therapists today on our panel been working whole day and then try to drive home as fast as you all can and rush through dinners to really come here to share all this wonderful knowledge and wisdom with us all. And we really hope what we talk about today can help you start thinking about this more, start prioritizing, or at least think mental health is important and start looking into those resources and be more open to this topic with yourself, your family members, your friends. And hopefully this kind of tragedy are less and less in the future if we can all start from educating ourselves about mental health and about different community resources, where they are, how to get them. And thank you for the Society of Heart Delight to join us today to organize this together. Yeah, and there are a lot of therapy resources out there, and I think we all work at different organizations. Some of us work together, some of us work in different community centers, and they all great resources. Yeah.
Thank you, Ishan. Thank you, everyone. Thank you for having this opportunity to talk with everyone, just brainstorm some ideas, and then it's the mental health is hard work. Let's support each other.
Yeah, hopefully more and more bilingual, multilingual therapists, gonna be there and start serving the community. I think that definitely gonna help a lot.
Mm-hmm.
Yeah.
Thank you all for your
Thank you.
Okay, thank you all. So that's it for today. Thank you all for watching. Okay, bye. Have a good night.